Hello and good morning. Before we start to the main topic for today, let me introduce myself and my partner. I am Nur Farah Najwa binti Madlan, number matric 05DPB 20F2009, and my partner Nureen Farhanna binti Muhammad Rafiz, number matric 05DPB 20F2001. As you can see today, me and my partner will be presenting the most common things that have been taught from year to year. Today, we bring you the analysis of total cases and deaths related to dengue in Malaysia. Have you heard about dengue? And what is dengue? According to the Department of Occupational Safety and Health, DOSH, in Malaysia, dengue fever is one of the most serious viral diseases in terms of human morbidity and mortality. It primarily affects tropical and subtropical regions worldwide, primarily in urban and semi-urban areas. Dengue virus infects humans via the bites of Strep Aedes aegypti mosquito that has previously bitten an infected person. Dengue can cause a high fever and other effects, which is headache, vomiting, nausea, and muscle pain. Without wasting any time, I will presenting you the data of the dengue cases in Malaysia from 2006 till 2015. The graph shown here is the dengue cases in Malaysia from 2006 to 2015. According to the Ministry of Health in Malaysia, in 2017, the dengue cases in Malaysia tend to fluctuate from 2006 to 2015. In 2006, dengue cases was 38,556 cases, rose to 48,856 in 2007. However, more than 40,000 cases have been reported in 4 years. Malaysia have experienced a sudden drop of cases in 2009 from 49,335 in 2008 to 41,486 cases in 2009. But in 2010, the graph shows a moderate increase, which is 46,171 after the drop in 2009. Surprisingly, the dengue cases in 2011 show a drastic fall with a total 19,864 after 5 years. But in 4 years later, there was a constant rise of cases from 21,900 in 2012 and rose drastically to 120,836 in 2015. Next, I will invite my friend Miss Nureen Farhanna to give an analysis of the dengue death in Malaysia and conclude the presentation.
And good morning to my viewer. Before I continue my discussions about the graph, let me introduce myself. My name is Nureen Farhanna binti Muhammad Rafiz. My number matrix is 05DPB 20F2001 from POLITEKNIK, KUCHING, SARAWAK. A line graph is used to show a total dengue related to death in Malaysia from 2006 until 2015. In 2006, the total of death of dengue was 92 cases, rose to 98 in 2007. However, the case in 2009 showed a drastic fall with a total 88 after 4 years. But in 2010, the graph show a moderate increase is 134 after it dropped in 2009. But suddenly, Malaysian of total deaths of dengue 2011 show a drastic fall, with a number cases are 36 after 5 years. But in 3 years, the record a constant risk of death from 92 in 2013 rose drastically to 215 in 2014 until in 2015 was 336 cases. In conclusion, I want to talk about how we want to prevent the mosquito bite. I have 4 points here. The first is stay in air conditioners, wear protection clothing, and third is use mosquito repellents, and lastly is reduce mosquito habitat. I want to details about stay in conditioner. The mosquito that carry a dengue virus are most active from dawn to dusk, but they also can bite at night. So the next is we must wear protective clothing. Like when we go into the mosquito area, wear a long sleeve shirt, long pant, shorts, and shoes. The third point is use mosquito repellent. Permanently can be applied to your clothing, shoes, camping gear, and bed netting. We also can buy clothing made from permethrin already in it. For your skin, use a repellent containing at least 10% concentration of it. So my last point is reduce mosquito habitat. The mosquito that carry the dengue virus typically live in and around our houses, breathing in standing water that can collect in such things as used automobiles tires. We also can help lower the mosquito population by eliminating habitat where they lay their egg. At least once a week, empty and clear the container they hold standing water, such as planting container, animal dishes, and flower vase. Also, we must to keep standing water container covered between the cleanings. That's all from my groups. Thank you and see you again.